As winter takes hold, we've seen a rise in weather-related deaths. Heart attacks are on the rise in Lake County, and around the state, we've seen 66 deaths related to influenza this season. To talk about all of this and maybe how we can prevent some of these deaths, we have Lake County Coroner Merrilee Frey and also Dr. Alex Stemmer, who is a infectious disease specialist and president of Franciscan Medical Specialists. Welcome to both of you.
Thank you, Steve.
So I know that it's cold outside, but is winter a particularly deadly season, Coroner?
Well, we've seen a rise in heart attacks here within Lake County. We've had many people come into the Lake County Coroner's office as a result of a death that we didn't understand what it was caused by, and upon examination we found that they did have a heart attack. We've seen a rise in that, especially among men in their 50s.
Men in their 50s are the prime candidate for this.
Yes.
And there are some... I know about the normal symptoms. You can get chest pains and things like that, but literally some of the symptoms include anxiety and stomach pain and upper body pain, things you wouldn't normally associate with a heart attack.
Yes, generally somebody may complain of some shortness of breath initially. They may or may not have some chest pain or discomfort that can extend into their neck, their upper chest area, to their jaw or teeth, or it may go lower and they could have some abdominal discomfort or pain.
So some of these people early on may not have realized that, in fact, they were having a heart attack.
Well, it's my understanding, and this is an important message that I want to get out, that we have had the family members of these individuals state that, in fact, they did have some shortness of breath and some chest pain, and they had been having it in recent hours to recent days, but did not seek medical care.
All right, and by the time they get to you, it's a little too late. But we'll get back to some of the ways we might prevent it in a minute here. But Dr. Stemmer, influenza, it sounds like it's been particularly serious this year. The flu, 66 people dead already this flu season. Is this a particularly bad strain of the flu we're seeing this year?
It's not unusual to have every other year, every third year, a more severe strain as the virus mutates and people don't have resistance or immunity to the current strain. This year is complicated by an unfortunate formulation of the influenza vaccination. The vaccine is not as effective this year as it has been in previous years. As you know, it's formulated in the very early part of this year based upon best estimate of what strain we'll see. And this year, they picked a strain, H3N2 Texas, and unfortunately 67% of our strains are H3N2 Switzerland, and they're not the vaccine is not particularly effective against that strain.
So it's not really working. So does that mean that the flu vaccine isn't valuable at all this time around?
No, not at all. My observation is that most of the people who have gotten ill, even though they've had vaccine, have had an attenuated illness. They're not as sick. And there's about a third of the strains that are actually prevented by the vaccine. And so I do think there's a broad benefit. And the B strain, influenza B, which tends to follow A, is the correct formulation, and it will be very effective for B. So I would definitely recommend that everyone who hasn't been vaccinated get vaccinated and don't lose confidence in the vaccine. It definitely is helping.
So is it a matter of this strain of the flu that we're seeing now is just worse, or it's just we're not seeing as many people that have a resistance to it?
This strain of H3 is an H3N2 strain. There are many, many strains of influenza with different H's and different N's. H3N2 epidemics tend to be more severe. This year's was more severe than last year. When I look at what we're seeing in our hospitals, we peaked a little earlier this year, when we peaked, we were seeing twice as many cases per week as we saw last year at the same point in time. Now, the peak has passed, and what I'm seeing suggests that we're already seeing less than we saw last year, this week of last year.
So when we saw 30 deaths in Indiana in 1 week right at the end of the year, and then another almost 30 deaths right at the beginning of the year, that was the peak. You're not expecting that to just keep continuing through February and March?
Well, you hate to commit based on early trends, but the trends that I'm seeing look fairly significant. And so I would say that it's much more likely than not that we are through the worst.
Through the worst of it. Well, that's good. And among those 60-some people who died, I mean, who are they? This is mostly the elderly, is that?
Well, there's two groups of people that are more severely impacted. One is the very young, so children under 4 tend to have more hospitalizations than children who are older and young adults. And then, of course, we have the adult population over 65. Then any complicating illness, whether it's heart disease, whether it's emphysema, whether it's cancer treatment, all will make influenza worse. And people may not die of influenza per se. They may die of congestive heart failure.
Okay. Well, I guess it all sort of dovetails back into what we were talking about with heart attacks as well. So let's move on to well, what do you do? Is there any way to prevent some of these deaths? Coroner, you were talking about, you thought there were some ways that people might
Yes.
take a look at things.
Well, I know with heart attacks and in prevention, if somebody can make sure that they get themselves to a hospital, if it would be best if they can call 911 to get emergency response if they're having chest pain more than a few minutes. If they don't have access to call for emergency help or a family member to call, to have somebody transport them as soon as possible to the nearest emergency room, or if they're alone and they don't have access to a telephone, at last resort to call themselves. To drive themselves to the nearest emergency room. Additionally, we have seen 2 men in their 50s that did present to urgent care centers complaining of these symptoms, and I believe that it would be best if they are having shortness of breath and chest pain to go to an emergency room where they have everything available so they can diagnose and treat a heart attack.
And we see this spike in the winter because shoveling snow, is that it?
Well, it's my understanding from the literature that I've read that it could be safe to shovel snow if it's somebody that's elderly or they have some health-related conditions, especially cardiovascular concerns. They certainly should ask their physician if it's safe for them to shovel. We have seen a couple snow incidences where people were outside, older people beyond their 60s, and they had been shoveling or they were out in the cold weather in their yard, and they came in this year and did pass away of a heart attack. So
and it's not a matter of, it doesn't happen right away a lot of the times. They have some lead time where you could get to help, but people
Yes.
don't often heed the signs. So when it comes to the flu, Dr. Stemmer, what can you do? How can we stay healthy this season?
Well, a few simple things. First, reiterate, get the flu vaccine. Second, in the midst of an epidemic, almost everything that feels like a sinus or throat infection is going to be influenza. The antiviral medication Tamiflu is very effective, and so what you need to do is get a prescription as soon as possible, and that means before 24 hours has gone by. So calling your doctor's office, saying I think I have the flu, requesting a prescription for Tamiflu, and starting it will radically diminish the severity of the illness. And then there's one more thing that you can do. Since influenza spreads through the household, if one of the people in the household has influenza, the others can take a lower dose of Tamiflu, 1 pill a day instead of 2 pills a day, and prevent getting it.
Now, do doctors often recommend that? Do they tell that everybody in the family should take this at some degree? Because I haven't heard that.
I think it's very specific to certain doctors, but I think it may be specific to certain circumstances, meaning if there's someone who's ill in the household, you definitely want to prevent them.
You should ask your doctor about that. And you shouldn't do what I normally do, which is just try to tough it out into the absolute last minute when I'm incredibly sick or maybe where I've had a pain and I've tried to ignore it. You should take action as fast as you can, really. That seems to be the bottom line here.
Take advantage of the advances in the pharmacy industry that have given us this medication. And if you think you have influenza, request it from your physician and go on it right away. Don't wait.
All right, well, that's where we're going to leave it. This has been Lake County Coroner Merrilee Frey and Dr. Alex Stemmer, who is an infectious disease specialist and president of Franciscan Medical Specialists. Thank you both for being on.
Thank you, Steve.
Thank you.
Thank you.